When you're living with ER-positive, HER2-negative metastatic breast cancer, testing is an important part of the process. However, that doesn't make waiting for the results any easier. But you're not powerless. When you understand your test results and advocate for yourself, you can take positive, proactive steps for your health and treatment. Hi, my name is Dr. V.K. Gadi. I'm a breast cancer oncologist, and today I want to help you understand your test results and how they can guide you and your doctor to make the treatment choices that are best for you. Sometimes cancer becomes resistant to treatment, which means your current treatment stops working. This can happen because cancer cells have changed or mutated. Mutations can cause resistance to certain types of therapies, which may be why the cancer progresses. Progression means that the cancer is spreading or getting worse, even while you are on treatment. An ESR1 mutation is an example of a mutation in metastatic breast cancer that may cause treatment to stop working. ESR1 mutations can be common after taking hormone therapy. Nearly 1 out of 2 people with ER-positive, HER2-negative metastatic breast cancer may develop an ESR1 mutation after progression on hormone therapy. ESR1 mutations are most likely to be found when your metastatic breast cancer has progressed on hormone therapy. Your current hormone therapy is no longer working. You have taken a hormone therapy for a year or more, or you have taken multiple hormone therapies. Whenever your breast cancer progresses, guidelines suggest you should be tested for mutations before you begin your next treatment. This will help you and your doctor understand why your disease has progressed and why your current treatment may no longer be working. Fortunately, testing methods have changed a lot in recent years. Today, it's recommended to get a blood test to help find mutations, including ESR1. A tissue biopsy on its own doesn't always identify ESR1. The process of testing is simple. This blood test can be done at your doctor's office or a lab. There's no need to fast or prep for the test. And like other routine blood tests, a regular-sized needle takes a small sample of blood from your vein, typically in your arm. A laboratory will test the sample, and you will get results back in about 7 days. A blood test provides information on all tumors by identifying their DNA, which may differ between tumors. Tumor DNA is also different from your own DNA. The results tell you if you have an ESR1 mutation or other mutations. Before you and your doctor discuss treatment options specifically for your type of cancer, you need to understand what your test results mean. Results may show that you have one or multiple mutations, for example, ESR1 and PIK3CA. Having more than one mutation is referred to as having co-mutations. Now let's look at the last column that shows percentages. Each mutation found in a blood sample has its own VAF percentage. The V in VAF means variant. Variant is a scientific way of saying a change in your tumor's genes. VAF may also appear as ctDNA percentage on some reports. If your report doesn't have VAF, look for the ctDNA percentage instead. The VAF percentage may be higher or lower for different mutations. Doctors use the VAF percentage to better understand the patient's cancer and the percentage of each mutation to help make more informed treatment decisions. However, breast cancer guidelines recommend treatment based on whether you have the ESR1 mutation and not based on how high or low the VAF percentage is. If your test results indicate an ESR1 mutation, this will help your healthcare provider in determining your next treatment path. Explore KnowESR1.com to learn more about ESR1 testing. KnowESR1.com also has other resources to empower patients to speak to their doctors and have productive conversations about ESR1 testing and treatment. The key here is empowerment. It's important to know as much as you can about why your cancer has progressed. Advocate for yourself and request a blood test for ESR1 mutations each time your cancer progresses or prior to a treatment change, so you can discuss therapies that target the cause of your progression and find the best treatment for you. And above all, remember that your doctor and healthcare team are there to help you understand your cancer. So move forward knowing you have the power to make a change. You may be the ESR1 out of 2, but you are not alone.